Well, I have been in touch with the directors at Hazel Hawkins, and my staff has also kept an ongoing dialogue to see how we can help. It's a variety of problems for Hazel Hawkins, some of which, they have problems over past mistakes. I'm not sure, I'm not saying it was anything malicious, but they have some overpayments, for example, on to the IRS. They owe $1 million that we're trying to get cleared up in terms of at least getting the penalties waived and maybe postponing some of what they owe. They are soon going to apply for the California State Grant Program for distressed hospital emergency funds. Some of that has been provided by the federal government. We did put substantial funds in the CARES Act and the American Rescue Plan for healthcare, and some of that money is being funneled through the state for rural hospitals. I do think there is an issue in terms of some of their Medicare reimbursement we're trying to help on. I know that they are also, and I don't want to discuss and violate any confidences, but I know they're in discussions with a third party, and that they have entered into bankruptcy, I think makes those discussions more viable, frankly. And I don't know what the end result will be. I'm doing what I can to facilitate and help that, but that would probably be the best outcome for them to emerge stronger and with a better capacity to bill off and have revenue. But I do understand how important this hospital is to San Benito County. And I've talked to so many people or former patients. The idea that you would have to drive all the way up to St. Louis and Gilroy to get hospital care is really not acceptable. And so I'm working as best I can to try and help resolve that. And they now are in better shape than they were before. They're not at risk of closure, and they do have enough funds to operate until next year. So that's much better than when I talked to them first in February, where they're thinking they would close this spring. We're on an even keel for now, but we're not out of the woods. And so we need to get those grants in and help them as much as we possibly can to affiliate or in some way associate with a stronger partner who can help move them forward.
What happened with COVID funding? In the reading I've done, a lot of that money went to large urban hospitals.
A lot of the COVID funding you had to apply for. And I think the capacity to seek funds from urbans might have been a little more developed than the smaller rural facilities. However, the Medicaid reimbursement rate was for everybody. It did help rural and urban alike. All over 3,000 providers in California received almost $500,000 in funding under that program. So was it everything? No, but it did help infuse some funding into the healthcare system, not only hospitals, but also clinics that were struggling to meet their expenses in the middle of the epidemic. The Children's Health Insurance Program received a boost up, along with a rural Medicaid and Medicare, as I say, a little boost up that did help rural hospitals continue. But of course, now the COVID emergency is over. Those enhanced funding have disappeared, and hospitals and clinics all over the country, not just rural ones, are feeling the pinch as a consequence. So it's a huge issue across the country.